for more on this, let's cross to our health correspondent, Nicola Hill, who joins us from London. Good to see you, Nicola. To mask or not to mask, it's so confusing. What is the latest situation, the latest decision and advice with regards to this?
It is confusing, isn't it? From my calculations, 30 countries have now made it mandatory to wear masks, like in Turkey, where citizens are being given 5 masks for free each week. Another 49 countries are recommending it. But as you say, Maria, here in the UK, we're being told that masks should be kept for frontline workers, for people working in the health service, and that we don't need them. Their argument, they say, is the fact that people will then become complacent. They won't stick to the social distancing rules, keep washing their hands whatsoever. But we heard Keir Starmer saying that the UK has been slow to various elements in this coronavirus story. And there are a lot of doctors here saying we're slow to implement the same situation, at least recommending that we should wear face masks when we go outside. The Mayor of London, for example, says people should have them if they're on public transport or if they're shopping. And the doctors are saying it's because if you wear a homemade mask or a basic surgical mask, not the N95 high-grade mask that health workers need, you can then stop any transmission of the virus that you might give to somebody else in the droplets that you breathe out or come out when you speak. And they're saying that if we all had masks, as we communicate with each other, we're protecting the other person. And that's why they're saying that it's a good idea for us to wear some sort of mask, even if it's a homemade one.
And with regards to homemade ones, how effective are they?
Well, here is my homemade mask.
Beautiful.
I have to admit, my friend made it for me. I don't know. This has got 2 pieces of fabric, and that's what's important. This is what we're advised, is that you need more than 1 piece of fabric. But if you have 2 pieces of fabric, apparently this then prevents up to 95% of viral droplets being excreted through your mouth. And what you have to remember, of course, is that for most people who get the coronavirus, there's 5 days before they show symptoms. And particularly the last 2 of those 5 days, they're incredibly infectious. And that's when they can infect other people. And of course, there's other people who are asymptomatic. They have no symptoms whatsoever, even though they've got the virus, and they're shedding that viral load. In other words, they're potentially infecting other people. So if they wear just something like this, a very, very simple homemade mask, there's lots of videos online showing you how to make them. You don't have to have a sewing machine. You can use shoelaces and whatever. But if people do wear these, then they're saying they're protecting others, the other people they come into contact with. And it's interesting that here in the UK, the government scientific body called SAGE did meet yesterday to discuss masks, and we are waiting to see if there's going to be a change in the recommendations here.
All right, let's see what they say. But meanwhile, you have a fantastic mask, Nicola. Thanks so much for speaking to us today on TRT World.